Computer. I am so excited for everyone to join us today. This is Kristen Richards, and I am so blessed and honored to have the Carla Whorton with us again today. If you are new to this community, then we have some great recordings Carla and I have done previously. But if you're new to us, welcome. I'm super excited and always enthusiastic. When Carla sends you a text and says, "Hey girl, we need to do another call." You say, "Yes, ma'am. When can we schedule that?" So Carla is a nurse practitioner, and I'm going to let her explain all her incredible letters and accomplishments that she has after her name at her own free will. But I do just want to give her a warm welcome. Carla has dedicated so much of her time, her energy, her brain power. I always talk about her big, beautiful brain to helping us understand all the different pieces that are going on and coexisting within our lipedema bodies. There's so many factors to consider. And Carla, I'm just so grateful that you are here. She is newly published, you guys. That is a humongous accomplishment. So the Lord just continues to work through Carla and help other researchers and scientists and nurse practitioners and medical professionals better understand what the heck it is that we've been dealing with all these years. So Carla, welcome, welcome. I'm so happy that you're here. So first, give us your official, I know you're a nurse practitioner and geriatric, give me all the American, like all the letters. I know I'll butcher them. So
All right. First off, I have been in the medical profession for 46 years.
amazing.
I've spent the better part of 46 years in the intensive care unit, cardiovascular care unit, and rapid response and stroke.
Yeah.
I've seen the end stages, a lot of the diseases that I now spend so much time trying to prevent.
Yeah.
And my post hospital experience education is through A4M. That's the American Academy of Anti-Aging Medicine. And it's about preventing the diseases of aging. And it's all tied up with hormones because it's no coincidence that our hormones are tied to all of the diseases of aging. And it's proven that balanced hormones after 65 actually prevent all-cause mortality by 19%.
Yeah.
And I add bioidentical hormones because there have been so many lawsuits. The data speaks for itself against synthetic hormones.
Yeah.
The Women's Health Initiative study in 2002 was stopped early. The only hormones that they tested in that study were synthetic hormones. Mm-hmm. What got me down this lane, though, is I had breast cancer at 29 with a double mastectomy. I had fibroids at 41 with a total abdominal hysterectomy. When I had breast cancer at 29, I had a 5-month-old baby. And much to my dismay, my baby started having her own problems of estrogen metabolism at only 21. She had severe endometriosis, so bad that she did have to have an excision. At only 31, she had fibroids and was diagnosed with adenomyosis. Then she said she suddenly developed lipedema. Brandy developed her lipedema very fast. We did not know what it was. I was still working rapid response stroke at the time. I didn't know what it was. She got her diagnosis through Dr. Herbst, and I'm so thankful for her.
Yeah.
And then when she told me she got that diagnosis, she said, I told her, I said, Brandy, I'm so sorry. And she said, well, you have it too. And I So
Congratulations. It's a family affair.
well, I have three sisters. My
Mhm.
legs were never as pretty as theirs. They
Mhm.
were that lumpy bumpy from the knees up.
Yep.
And I was always really trying really hard to lose weight. I felt like I could not eat.
Mhm.
And I felt like for some reason my body wasn't supposed to eat because that's what it did. I was up and down all the time. And I feel like that's one reason that I got breast cancer, because I was so stressed out about that and I was not treating my body right.
Yeah.
But what connected all of this is that we started going to a naturopathic doctor somewhere in the middle of all of this. Probably Brandy was in her mid-20s, and she diagnosed us with a genetic polymorphism called MTHFR
Mhm.
because of my history of the breast cancer. And my brother actually passed away at 60 and from heart disease. And because of all of that, she tested us for MTHFR. And I didn't realize the full implications of that. But I was a stroke nurse at the time. So I saw some worst case scenarios. Really, if my family wasn't bad enough, I saw some really bad incidences, but I did not connect all of that to lipedema until I started studying more and more about the Dutch test and that my naturopathic doctor did on us ever since it came out, probably about 12 or 13 years ago. And my advanced certificate is in advanced metabolic endocrinology that I chose not knowing it was going to be the precursors and metabolites of estrogen. And that is where it's all at.
Incredible.
That
Incredible.
got me here.
I love hearing that. And it truly is, the life experience paired with where the Lord had you working to in all the various levels of exposure to
Absolutely.
because he knew this day would come, right? That you'd be able to put these pieces of the puzzle together to get published. Carla was so sweet. She texted me the night. She said, I'm published. We'd been talking about this over a year, her doing her due diligence and research and finishing up her paper. So I'm just so excited because that's the topic today. We want to talk about your publication. I'd love for you. And because when I read this, I have to plug it into Claude and say, okay, Claude, put this in English for me. And I'm very transparent with Carla about that. So she's going to take this information, it's very dense information, but she says she's got a fairy tale version. So she can help us better understand everything. So Carla, if you want to start giving us the title of your publication and then
Sure.
just help us fill in the voids, fill in the blanks, and explain this as if we were sitting in your office as a client.
Okay. The article's name, and I have to go back and read it because it is a long name.
Yes.
What she has right is From Estrogen Metabolites to Fibrosis,
Yep.
16-hydroxy TGF beta, mTOR axis as the shared pathway in lipedema as established in other estrogenic fibrotic disorders. And now that is a mouthful, I know. However,
It is.
what I'm going to explain is that these pathways from estrogen metabolite, and I will go over that with you, starting with the Dutch test. I can actually see if I've got one of them right here instead of just going through through it. I like to do show and tell with my patients.
Yeah.
And but what I explain is that we have three estrogens, not just one.
Yep.
And I will start with those estrogens. And I actually, Carrie Jones, that used to be with Dutch, she explained these three estrogens as the sisters. And three sisters, I don't remember exactly how she explained it, but I explain it as E1 is the big bad bully sister. She's the old sister and she's a bad bully. E2, estradiol, is the middle sister. And everyone knows how the middle sister has to fend for herself. She learns responsibility. Well, the older one does too, but this is how I have to describe it so that it'll make sense to you. Estradiol actually is protective of our fat cells. There's hundreds of jobs that estradiol does in our body. And it actually prevents heart disease by 52%.
Wow.
And that's huge. And it prevents dementia. It actually causes the inside of our blood vessels to release nitrous oxide. And so it's a natural antihypertensive. And think about liver fibrosis for a minute. As long as our hormones and metabolites, and I want to stress metabolites, are balanced, estradiol even protects the fat cells in the liver to prevent them from hardening and end up causing cirrhosis. And then we've got the little sister estriol. She's E3. Now, she doesn't do much at all as far as go out and do a job like estradiol. However, she's very important at being lazy. Okay. She sits on estrogen receptor beta all the time, just sits there. And the fact that she does that can prevent fibrosis actually, because most of the fibrotic signals come from estrogen receptor alpha. And as long as she's there, she's going to protect that and prevent that pathway. Okay. But what happens as we get older? We start losing a lot of our breaks. And the first break that we start losing is our testosterone. Women have as 3 to 10 times as much testosterone in our body as estrogen. And that is our lean mean. It maintains our lean tissue. It also makes cells more responsive to insulin, which that prevents diabetes, high blood sugar, and all of these issues. That actually starts going down at 18, only 18. So that's the first break to start. That's our break. It's pedal to the metal at first, and it starts letting up. So that's going to make us more prone to weight gain. Okay. Then at 25, we start losing our progesterone. So there's a lot of mental issues that can be going on at these times also, because with testosterone, we have a little bit of that alpha edge, a little bit, not as much as men, but we have a little bit of it. So that's decreasing. We're losing a little bit of self-confidence. Then at 25, we start losing our progesterone. Most women do. And by the time we're 35, it's only half what it used to be. Wow. So progesterone is our opposer. Estrogen is proliferative, causes things to grow. And progesterone opposes that. As long as we have our progesterone and our estrogen, it's kind of more smooth sailing. But progesterone is also nature's Ativan. So nature's Ativan helps keep us calm. It helps us sleep at night. And it also is what holds the fetus inside the uterus. Wow. Yes, that it prepares and holds that fetus. It's like a sticky hormone. So the first thing that we notice in our at 25 or even our late 20s is that we can't sleep as well, because progesterone helps us sleep at night. And it affects the GABA receptors. Then we can say, and go to sleep at night. Yeah. So we're losing those 2 breaks. So then as we get a little older, we start losing our estradiol and our estriol. Now, those are both breaks on fibrosis. Okay. Now, estrone, the big bad bully sister, she is the one that breaks down into a harmful metabolite, 16-hydroxy. Okay, 16-hydroxy is very proliferative. And he is like his mother. He's very bold, very aggressive. And 16-hydroxy actually has a stronger affinity for estrogen receptor alpha than estradiol. He can actually push estradiol, the middle sister, off of the receptor site. And when he does that, he's going to take a sit on the throne. I call the receptor sites the throne because that's where they do their job, just like a king or a queen has to do their job. So when 16-hydroxy sits on that throne, he cannot do the job of estradiol. So it's almost like we're already low on estradiol, and she's so protective of our whole body. But he sits there, and I call it squirming around on the throne because he causes a lot of inflammation.
Okay.
Yes, he is called covalent bonding. He sits there and does not leave. And the more of this you have, the more saturated those receptor sites come.
Okay.
So this is where 16-hydroxy causes so much inflammation and micro injury in the tissue. And micro injury, by the way, can also be caused in the tissue of Ehlers-Danlos. Connective tissue disease can cause, we can have micro injuries, micro trauma all the time. We can also have micro trauma from those mast cells. Estrogen dominance, due to the decrease of our progesterone, causes the dysregulation and the degradation of those mast cells, which cause the release of histamine from those granules. Okay. So all of these things go hand in hand. Progesterone actually controls that. So you can see all the way through this process is a continual tug of war between progesterone and estrogen. So start losing our progesterone, we do get estrogen dominant. And all of these things can start happening, even if we don't have 16-hydroxy, but even worse if we do. So when these micro traumas occur, it's the tissue itself starts alarming for help. It's like they start alarming, and this is all true. I couldn't make it up, actually. I don't have that much of an imagination. But it's like they're yelling, help, help, I need help. And this is where the inflammation comes in. Okay. Cytokines start coming out. One of these is a growth factor. And the growth factor itself is called transforming growth factor beta. Okay. Transforming growth factor beta is the most critical growth factor of every fibrotic process in our body. Okay. It has been documented since the 80s and 90s to be associated with breast cancer. And through the years, it's been associated with endometriosis. It's already well associated with fibroids. It's well associated with cardiac fibrosis, pulmonary fibrosis, pulmonary artery hypertension because of the fibrosis, even prostatic hypertrophy. My question is, why has this pathway not already been discovered and claimed for lipedema? But it is already documented very well from many sources, including Dr. Herbst, that says it's a fibrotic condition. Bickman about, I think in 2024, so he did a video that did say he thought that it was TGF-beta that causes the transformation from fibroblast to myoblasts, and that's what causes this production of a sinister collagen. What he did not say was, and I knew immediately. He said there is there has to be an estrogen that causes the stimulation of a sinister collagen. Well, I knew immediately which sinister estrogen that was because of my studies. I listened to that about 2 years ago. So that is what started me on this pathway.
Okay.
So let me first give you an example. And the example is this. You know what a vampire facial is. Invented by Dr. Runnels in South Alabama. I have to give him a shout out.
Okay.
He also invented the O shot and the P shot. And what he studied very successfully, because they're all very successful treatments, is what the growth factors in platelets.
Okay.
And how when they're injected into the body, or like platelet-rich plasma, we draw your blood, spin it, and microneedle it on the face.
Yeah.
Okay, and imagine a cut on the arm. So what happens is these platelets rupture, and I call it the platelet bomb because they rupture and they let out all these growth factors. Okay, so these growth factors on the face is going to be an acute wound healing. Okay.
Okay.
Acute. So it's acute. It does its job and actually does it very well to cause replacement of our collagen under the skin on our face. So compare that to Derkham's disease and lipedema. These are what we call chronic, out of control wound healing. That is what I'm calling it. I have not heard that anywhere else.
Okay.
That's what I call it in my article. Because with Ehlers-Danlos, with lipedema, due to the 16-hydroxy, okay, the mast cells, it's a chronic stimulation.
Okay.
This is out of control wound healing. And I usually show a picture of these three things, the vampire facial, and I ask them, what do these three people have in common? And I let them think about it through my presentation. And by the end of it, they say growth factors and wound healing. So that is, I like to present it that way. So what happens? The tissue starts alarming for help.
Okay.
And guess what? These little molecules are called that are alarming. They're called alarmins.
Finally, something that makes sense in this equation.
Sense. They're called alarmins. So these alarmins come out.
Okay.
And then transforming growth factor beta comes out. So I call him the general, transforming growth factor beta. I call him the mean general because when he comes out, it's like he's bossing everyone around. Excuse me. And he's taking control. He's completely in control. One thing he does is he goes to the cell. He realizes this is a long process. And you know how a kingdom looks, like you've got the kingdom and the two guards outside. The two guards are called SMAD2 and SMAD3. They're messenger molecules. So TGF-beta says, I need to talk to the DNA queen. I've got a lot of repair work to do, and this is going to take a lot longer. This is not just a little thing. These highways are a wreck out here. This roadway is a mess, and I need to get the budget okayed. Okay. So the messengers go inside to the queen, the DNA, and they tell her what's going on, and she says, well, if he must, he must. And right that second, DNA transcription is changed. It's changed from the simple stimulation of fibroblast on the face to myofibroblasts. And this is the sinister collagen. Okay. Because this is a long-term wound healing. It turns into the sinister collagen 1, 3, and 6, which is more fibrotic.
Mm-hmm.
It is more stenotic. And that's what is causing these hard collagenous bands that end up enclosing this little cage of toxic milieu. And the adipocytes also can harden and come very inflammatory. So we start fibrosing, but he's not finished. We have our own cleanup crew in our body.
Mm-hmm.
We have our own cleanup crew that normally goes through our body degrading fibrosis. These are called matrix melanoproteinases.
Okay.
Matrix and I may be saying that wrong. Okay.
Yeah. Okay.
They constantly march through our body, breaking down things. And as through our life with this buildup of fibrosis, if we did not have those MMPs, we would be just one continual. By the time, we get to old age, we would be one big, huge ball of fibrosis. But TGF beta actually causes the release of a molecule called TIMPs. This is tissue inhibitors of metalloproteinases. So it's just like the mean general stomps his foot on the MMPs. So do you realize what's going on now?
Wow. Yeah.
So we're now growing fibrosis, new fibrosis on top of old fibrosis.
Right. Right.
Okay. So we've got TGF beta, the mean general, going through our body, wreaking havoc. And the last thing he does, and we'll go into other reasons that these things happen also, okay? The last thing that he does that brings it full circle is that right outside the cell, or the mitochondria, you're aware that the mitochondria is constantly cranking out energy. Yeah. That's the powerhouse of the cell.
Yeah.
Well, the mitochondria responds to a molecule called AMPK. It's an enzyme. So AMPK is like our gas gauge in our car. When we see that gas gauge is down, we know I've got to stop and get gas or I'm going to run out on the road, So AMPK is the gas gauge to our body and senses when ATP is low. So he can yell inside the cell and say, hey, we need some energy, start cranking out that ATP. And so the mitochondria starts cranking it out. The mitochondria and inside the cell performs so many duties. It can use glucose for energy. It can break up the fat for energy. And when we have metabolic flexibility, this is what's happening, okay? And it can switch on a dime. And that's where the ketosis comes in. It can switch from burning glucose to breaking up the fatty acid and the glycerol and start burning that for energy. It can also, the mitochondria know when they're getting old. They self-destruct and we form new. That's mitogenesis. They also communicate with all of our hormones. Estrogen is the gatekeeper of the mitochondria. So when we don't have our estradiol, it communicates with our insulin. It communicates with our thyroid hormones. Wow. It also gets rid of reactive oxygen species in the cell that build up. So this is in a dynamic, energy-filled life and body.
Yeah. So
what TGF beta does, he stomps his foot on AMPK. The mitochondria no longer has that gas gauge, so he causes mitochondrial dysfunction. That's why there's no energy. That's why there's fatigue. That's why people with lipedema can't easily fast or do keto,
Yeah.
because they can't switch. They have no longer metabolic flexibility.
Yeah.
And if they do, and they do react to this, and my daughter was one of the best examples, she would have a cortisol peak. Her body, she would have a terrible reaction,
Yep.
and cortisol peaks, and we all know that cortisol peaks make us gain weight.
Yes.
Okay.
Yep.
Micro trauma in these cells, and this is what is happening. And so these cells can no longer detox, and there's more reactive oxygen species building up in the cell.
Yeah.
And if these people do overdo with exercise, they may pay for it for days. My daughter used to, if she did try to push it, she ended up she would feel like she had the flu for days on end.
Yeah. Yeah.
And even break out into a rash because of their reaction.
Mm-hmm.
So what happens then? We have all these rapid reactive oxygen species in the cell, and they have to be detoxed.
Yeah.
You know that. Okay. So right now in the cell, what's going on is hypoxia. So hypoxia inside that cell creates the release of hypoxic inducible factor. Is it 1A or A1? I forget. So what happens? That causes fibrosis.
Wow.
So all of these things that are supposed to be going on in the cell, and they're all listed in my article. There's 8. They are causing more fibrosis themselves. Okay. What happens then is because the cell has lost its metabolic flexibility. In a defensive mode, it creates insulin resistance.
Wow.
So then insulin starts going up. Insulin is the most toxic inflammatory, even though we have to have it to live, it's the most inflammatory molecule in our body, because when we have insulin peaks, the downstream effect of insulin are all of these inflammatory cytokines, even more of them.
Wow.
So it's like when I was in ICU or CVICU, and we have a patient with insulin resistance or with DKA, they come in with a blood sugar of like 700 or 800. First thing we do is start an insulin drip. Okay. If we have a patient with acute pancreatitis and a triglyceride 3,500, I've seen it many times, we hang an insulin drip. We got a high potassium, we're going to push 10 units of insulin, but we have to give glucose behind it, because insulin is a storage hormone and pushes every single thing into the cell. It's as long as you have high insulin peaks, it is so difficult to lose weight. So we have to address insulin resistance. What happens then, though? You can see now, Kristen, that we have about 8 self-sufficient loops inside the cell that will go on and on regardless of what we eat or don't eat.
Right.
And that's why it is not your fault. Okay. It is not the fault. This is a process that is going to go on and on. And then the major self-reliant loop that I've identified in my article is the one overall, because all of these reactive oxygen species have to go back to the liver to get the liver to detox our body.
Okay.
So it gets back to the liver. So in the liver, the first phase of detoxification is hydroxylation. When our hormones, when our estrogens get to the liver, the liver hydroxylates our estrogens down 3 different pathways. On the Dutch test, it shows these. We have 2-hydroxy, which is the preferred pathway.
Okay.
We have 4-hydroxy. 4-hydroxy produces quinone reactive molecules that actually can damage the DNA and cause cancer. Then we have 16-hydroxy. 16-hydroxy is proliferative. 16-hydroxy makes things grow.
Mm.
This first process of hydroxylation, if you can imagine, is like taking a pin out of a hand grenade.
Mm.
These are toxic.
Yeah.
Okay. The second phase of detoxification in the liver is glucuronidation, is methylation, sulfation. There's about 6 Ations, okay?
Okay.
So when this goes down the 2-hydroxy pathway, and at the bottom of that page on the Dutch test, I wish I had that just to show for a minute. Let me see if I do, because if I could hold it up for 1 minute, it would be more relatable. Okay, I do. Can anyone see this? Can you see this?
Yes.
Okay. Starting at the top of the page, we can see our progesterone. Our progesterone, like I said, starts going down at 25. We're estrogen dominant. Then our estrogens are here. Pretend this is the liver. Can you see?
Pull it up a little bit because I can't see where you're pointing now.
Okay.
There you go.
Okay.
That's better. Yes.
This is our 3 estrogens.
Okay.
We have the big sister estrone. We have the middle sister estradiol.
Okay.
We have the little sister estriol. They are now hydroxylated. The preferred pattern is the green arrow. It goes straight down. You can see the red arrow. That's 4-hydroxy.
Yep.
It's the one that causes cancer. Here is the 16-hydroxy here. This is the one that causes proliferation.
Okay.
Right down here at the bottom, 2-hydroxy. If everything is okay right here, MTHFR and COMT, this process can go all the way out, and 2-hydroxy gets converted into 2-methoxy. Okay. So can you get that picture in your head?
Yes.
Okay.
Yep.
So I'm going to put it down for a minute. Methylation, I like to compare methylation as if we're cleaning out our house. Okay. It's spring cleaning and it's Saturday. We're gathering all the trash up in our house. And as we bag it up into those big plastic bags, we toss it out into the laundry room. And we're thinking to ourselves, tonight when I'm finished, I'll go out there and I will take that trash and I'll take it out to the dumpster. Yep. Okay. Yep. Okay. That night comes.
We don't.
We can't, because we have MTHFR.
Okay.
Or COMT. So we can't get out that back door. I call it, you see where this methylation is really low right here?
Yes.
That means that back door is locked and we can't take the trash out.
Wow.
What happens is that trash backs up into our body and our house, and it keeps building up. So the liver is up here trying to do its best. Yeah. And this is one reason that people with MTHFR have an increased risk of liver disease. Okay. The liver is overworked. Like my dad at 32 had liver disease. So what it's trying to detox all of these other toxins that came back from the mitochondrial dysfunction. Wow. Then it pushes all of the estrogens on back over into 16-hydroxy.
Which makes everything grow.
Which is the cycle. 16-hydroxy causes the increase of TGF beta. That is well documented. And that is the huge, and I've never heard it called what I'm calling it. And like I said, it has never been called in research. it has never been identified as the lupin lipedema. But what has been identified and documented very well through the years is, and I'll look at my dates, because I had breast cancer 40 years ago, Kristen.
Wow.
My baby was 5 months old.
Wow.
She grew up to be 21 and started having these issues herself.
Mm-hmm.
Standard medicine still does not test for MTHFR. And if you ask them to test for it, one of my own patients told me she didn't even know. She didn't know what that was. She was criticizing me. A criticism to me. That is a criticism to the doctor, because if doctors tested for MTHFR, 65% of the population has MTHFR.
I've heard that stat. Yeah. Mm-hmm.
65%.
Yeah.
So right here, let's see, in 2012, it was identified by Wynn and Ramalingam. I'm probably killing his name. Identified, and get this, TGF beta driving fibroblast to myofibroblast conversion and SMAD2/3 signaling.
Wow.
That was known in 2012. I pulled up the earliest, but in my article, I tried to use the latest.
Sure.
Sometimes they did use the earliest to say, look, it has been known since then. Okay.
Wow.
TIMP mediated MMP suppression trapping, get this, and I have seen some call lipedema as trapping.
Yeah.
TIMP mediated MMP suppression trapping fibrotic extracellular matrix.
Huh.
That was also Wynn and Ramalingam in 2012.
Holy.
TGF beta, mTOR driven mitochondrial dysfunction and AMPK suppression. Get this, Halberg et al. 2009.
Oh my gosh.
What they discovered is the hypoxic inducing factor 1 alpha and adipose fibrosis. Adipose fibrosis, that sounds like lipedema to me.
Yeah. Yeah.
Recent is O'Leary et al. In 2020, TGF beta, the mTOR C1 / ATF4, and I don't know what ATF4 is. I do know that mTOR is they used to call it, I think now they call it mammalian target of rapamycin, but it also, TGF beta stimulates mTOR, which causes mitochondrial dysfunction by stomping down AMPK2.
Right.
Also, so you have two different arms stopping AMPK. Okay. 2-methoxy, that product that I showed you, is actually protective of our body. When it turns from 2-hydroxy to 2-methoxy, it's protective. It blocks hypoxic inducible factor 1 alpha. It blocks it.
Wow.
So 2-methoxy, as shown on that Dutch test, is anti-inflammatory in our body.
Wow.
Okay. 2-methoxy as endogenous brake on hypoxic induced factor 1 alpha is kind of like our own, you know how people take colchicine because of inflammation in gout? It has our own internal colchicine binding mechanism.
Huh.
It blocks HIF 1 alpha. The earliest that was known is Mabjish et al. In 2003.
Oh.
The most recent, we've got a study, it comes through the years, is 2022. And the reason this frustrates me so much is that 21 years after I had, when these things were known, all brought together, my daughter started having her problems. My daughter was sick. I did not know how to take care of her.
Right.
23 years after I had breast cancer, naturopathic doctor, and I take my hat off to her to this day, Dr. June Stevens, finally tested me for MTHFR. And through the years, God has revealed bits and pieces of this to me. Then, when my daughter was 31, she had the adenomyosis so bad and the fibroid she had to have removed. Then she developed. If someone cared to test, and I do care, I do care, and I test every one of my patients for MTHFR and homocysteine, because one of these pathways can cause high homocysteine levels. Homocysteine, you're not going to believe this, actually increases the sensation of pain in your NMDA receptor.
Wow.
My patients with the highest, I've had functional medicine and anti-aging medicine does not let a homocysteine level go above 8.
Okay.
And usually it's 5 to 7. So standard medicine says it's okay to go up to 15. Homocysteine can cause fibrosis. It can cause breast cancer. It can cause irritation of the inside of your arteries, which is, it causes your blood to clot easier, which was what was wrong with my brother.
Right.
My brother was 53 when he had open heart surgery. I was 43. 2 years later, he clotted off his new grafts. 2 years later, he clotted them off again. He had to go every 2 years and get stents put in his arteries. He had 5 stents in his RCA.
Oh my
I
God.
didn't find out till 3 years after. At that time, I had already been in the medical profession for a long, long time. I kept thinking, why is he so hypercoagulable?
Yeah.
Then I was a stroke rapid response nurse when I found out that I had 2 copies of MTHFR. My daughter has 2 copies, and Gabe has 1. Gabe is my baby. I had after breast cancer. And Brandy is my daughter that was 5 months old at that time. And I'm so thankful. My son is 36 and my daughter is 40 now. I have so much to be thankful for.
Yes. Yes.
However, so many people have not been blessed to raise their children like I have been so blessed to raise mine.
Yes.
If they would lump all of this into one pathway and recognize this pathway so that these young girls, they develop lipedema and say, well, okay, I know now that this puts me at a higher risk for breast cancer. You know, I might need to do a Dutch test to see, and I might need to be tested for MTHFR so I can assess my risk and do something about it.
Yes.
This is an easy peasy fix. Okay. I'll let that one slide. It's an easy peasy fix, but you can't just go out and start taking methylfolate because our body needs only enough methyl groups. It does not need too many. Too many methyl groups are over methylating is a problem too.
Yes.
And I've had people tell me, well, I'm covered with that because I take methylfolate. No, you can't do that.
Yeah.
There's even a book called, I've never read it, but I have it, Stop the Methylation Madness.
Okay.
And I wish I could quote the author, but there is, I would like to give her that credit. I can't remember that author.
Yeah.
But if you over-methylate, you're going to have anxiety. There are going to be too many methyl groups in the liver.
Okay.
I do a combination, and I'm not going to tell that combination because this is to educate.
Right.
And I have even thought about lumping these pathways all together to call it my name, because I am saying for the first time,
Yes.
all of these pathways are connected.
Yes.
And it also should be formally connected to lipedema, because the research is there connecting it.
Right.
No one has just done it yet.
I say we do it. I'm voting. We do it. And it, because you explained it in such an intricate circular pathway and the downstream effects of all of this.
Yes.
No, we're not going to obviously diagnose or give, supplementation recommendations or any of that. But the biggest takeaway, I mean, not only the mitochondrial dysfunction and the impact on our mitochondria as we age and the different pieces, but is the easiest, I'm doing air quotes, the easiest takeaway if we suspect we have lipedema, say we have or have not been diagnosed, is to check this MTHFR pathway to see what's not. I mean, that seems like the no-brainer takeaway.
Yes, check that. Check that, and of course, this is all educational purposes only.
Yes.
And check the homocysteine level.
Yes.
And but it is well known that if you have uterine fibroids, and that connection was made in 1996. And endometriosis also, that connection with the estrogen, what we go by looking at the Dutch test are the ratios, because remember, 2-methoxy is protective.
Yep.
4-hydroxy can cause cancer.
Yes.
16-hydroxy causes proliferation through upregulating the mean general, TGF-beta.
Okay.
And in TGF-beta, that's been known, I think I've already called you out that one,
Yep.
TGF-mediated MMP suppression in 2012. Let's see, we go by the ratio of the 2-methoxy to the 4-hydroxy,
yes.
the 2-methoxy to the 16-hydroxy, and even a little bit favoring the 16-hydroxy, you're going to be into that proliferative pathway.
Yes.
And if you're not methylating well enough, say you get to the 2-methoxy, and that back door is locked, because in order for COMT to go to methylate everything out, you have to have the MTHFR enzyme, which is the same name as the MTHFR polymorphism. It's methylene tetrahydrofolate reductase. The enzyme is the name. And you have to have the MTHFR enzyme. You have to have samidinosyl-methionine. You have to have magnesium. You have to have zinc. If you don't have the substrates, you're not going to methylate.
Okay.
So your 2-methoxy to 2-hydroxy matters also. And if you have one copy of this gene, if you just say you have this gene, and I suggest people go on to YouTube and listen to Ben Lynch. He has so many, And what I have is I'm called heterozygous, compound heterozygous, because I have A1298C and I also have C677T.
Okay.
My daughter is what you call homozygous for 1298.
Okay.
And my son has one, so he's heterozygous for one of them. Ben Lynch started doing his pills about the same time that I found out I was positive for this,
Okay.
around 2011. He's compound heterozygous. So is his wife. He has 3 sons that are affected, and he knows, and he does videos on how he treats this one, how he treats that one. So you can see it's not as simple as just taking.
Sure.
Yes, because what works for one of his son has to be treated with this, one of them that, one of them is very hyper. You can be ADHD and be slow ADHD. You can be ADHD and you can be hyper. I knew in the 3rd grade that something was the matter with me because I went to sleep at the desk all the time.
Yeah. Yeah.
And through the years, I was always looking for something to make me feel better.
Yeah.
And I started reading, and I love to read. That was obviously getting up my dopamine.
Yeah.
Because this is tied with you need folate for your neurotransmitter production.
Yep.
It's dopamine, it's norepinephrine, then it's serotonin. And so the things that this can cause on a continuum, because from very, very slight issues, it's not just about the body, Kristen. And this is what's so sad with some patients is they can have a very slight anxiety, and MTHFR are known to have an increased perception of stress. Okay. They can have anything from very slight anxiety to very bad anxiety and panic attacks.
Yeah.
They can have anything from a very slight depression to a very severe depression, or none at all. But what they're going through, if they do, they're upset already about their lipedema, and doctors telling them, you just need to lose some weight. And they have this, they could possibly have depression anyway because of this.
Right.
This can cause autism.
Wow.
This can narcolepsy. This can, one of the actual treatments is there's a new medicine for autism, and I'm not going to say the name, but it's a much, much, much higher dose that is given for ADHD.
Okay.
And this is more complicated.
Yeah.
Just walking in and getting a lipedema diagnosis. If you have one copy of this or methylation, you could have an average of 30% decrease in your methylation activity.
Wow. With just one copy.
With just one copy. Okay. So some people come in and they'll say, well, I know I have it, but I just have one copy. So my doctor said it was no big deal.
Yeah. No,
it's a big deal.
Yeah.
Especially in the long run of your life.
Right.
So if you have 2 copies, like I did, okay, think about me in my 20s.
Oh my goodness.
Okay, this is why, let's start with puberty. And okay, so this is explaining, let's just go through that before I say this. At puberty, the hormones are coming out. Bam, bam, bam. Your liver is not accustomed to hydroxylating that much estrogen.
Yeah.
Okay, so all of your estrogens, all 3 of those big sisters could be through the roof. All 3 of those metabolites through the roof. Okay. And this is something to remember too with surgeries, because this particular test was taken after my daughter had her lowers done. And so detox is very important there.
Sure.
Drinking a lot of water. Every one of hers was through her roof.
Wow.
The liver can't metabolize that much, release that fast.
Okay.
Water, 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 So all three of her metabolites were through the roof.
Wow. Yeah.
Okay. This put her at an extra risk. And the reason I'm saying this, and I don't see the exact year, but it is documented that if you have an increased risk of fibroids, you have a higher risk of breast cancer. If you have breast cancer, you have a higher risk of fibroids. You have a higher risk of adenomyosis.
Yep.
So if you have lipedema,
you're in that loop.
And you're in that loop, you have a higher risk of those too. And this is not to scare anyone.
Yeah.
This is to make you aware and have your MTHFR tested, have your homocysteine tested, have a Dutch test if you can, but have a Dutch test to check your methylation. Ben Lynch says that a homocysteine level is the poor man's
Dutch test.
MTHFR
test. Okay.
But LabCorp, with my patients, I bunch it in with their labs.
Yeah.
And I put it on there because I hear the risks. Because I could do a complete evaluation and their complete family history. So what I can hear is, I had heart disease, like my family history.
Yeah.
My dad died at 32. Okay.
Wow.
And I won't go into all that. This can cause addictions because of the dopamine reward pathway.
Okay.
So, and tirzepatide has been shown to be effective in every system of the body, not just breaking down fibrosis. It helps, and this is educational purposes only. I've got my merry-go-round picture here that I teach my patients. It helps the brain in that it also is effective with Parkinson's and Alzheimer's because it decreases neuroinflammation. It's also effective with addicts, with alcoholics, and because it stops the dopamine from peaking when they go out to do it. So I do it. And so it helps the brain in so many ways. It actually increases cardiac contractility of the heart, and it helps in congestive heart failure patients. But it also helps people with MTHFR because of what it does for the brain. And but MTHFR, it's easy peasy fixes. And but after going around that, so let's go back to, if you have 2 copies of it, your methylation could be down by 60 to 70%.
Wow.
So if you have 2 copies, like I did and Brandy did at puberty, we didn't develop lipedema right then, but the doctors told me that if my breast cancer started, if I found it, it was so big, I found it myself, that it had to have started at like 21.
For sure.
So that meant it had to have been affecting the tissue at the tissue level since I was right at or after puberty.
Right.
And going by the same analogy, Brandy's endometriosis had to have started happening right at or after puberty to have been that severe. So in that same token, that's why our pubescents can develop lipedema. And then we get 18, we start losing our testosterone. We can't protect our lean tissue as well. Then in our 20s, we're starting to lose our progesterone. So our progesterone starts going down. So what is happening here is we're losing our brakes on fibrosis.
All the protective stuff.
And so many people say, no, don't do hormones because it makes everything worse. If you are looking at the Dutch test, and this is why I'm not afraid, right now. And I don't know what's going to help in the future, but I've been on bioidentical hormones for 20 years.
Yeah.
And even though I've had breast cancer,
Yeah.
and I'm not suggesting anyone go out
Right.
there and do
Right.
it.
We're not saying that. Yeah. Yeah.
And sue me for it. But I know I have my progesterone back
Yes. Yep.
that opposes estrogen.
Right.
I know that as I get older, my estrone is the only estrogen that's left, and it breaks straight down into 16 hydroxy.
Huh.
Our E2 and our E3, by the time we're going through menopause, are usually gone.
Wow.
And this is why, if you just look at a blood test and they say, oh, you're fine, you're not even going through menopause yet. They didn't look at the estradiol and they didn't
Right.
look
Right.
at the estriol. Estradiol and estriol protect us.
Wow.
So estriol goes down first, and we don't have it. It's protective, sitting around on estrogen receptor beta. And our estradiol starts to go down when we get older. So we've lost 2 more breaks.
Wow.
So with MTHFR, and if we don't have the MTHFR enzyme down there, if we have 2 copies and our methylation is down by 60 to 70%, our back door is closed.
It really does blow your mind when you think about the amount of information and the cycles and the loops and everything and how it works together. And it's so incredible to get to understand it and hear you explain it to us. But then if you just pop back over into normal Western medicine where they're handing out birth control and antidepressants instead of bioidentical hormone replacement theory or therapy, and they're not testing for MTHFR, and no one's talking about a Dutch test. I mean, and I see, because that's what you have texted me privately and said, I just get so heated. And I can completely see why when we see it all come together like this. And the
And I think I will call it the Whorton framework.
Yeah.
Because it needs to be named.
Yeah.
I'm the one that found this out.
Yes.
All of these pathways and connected the dots.
Yes. Yes.
I've been working on this for 2 years, and
yes.
if I don't know if it would be adopted or not. It may be in a way to make fun of me. Yes, you called it her name, but it needs to be identified.
Right.
If it is identified,
yes,
and where these young women, see, it's been 40 years. They don't know any more than I did 40 years ago when I had breast cancer.
Right. Right.
Because I see them on these Facebook groups and they'll say, I was just diagnosed with this or that. And is this related? And I say, yes, it's related, but only 2 or 3 or 4 of them might see it.
Yeah, I know.
And even though I put all that time into the comments saying, yes, it's related, and this is how.
Yes. Yeah.
And it cannot be disputed because, like I said, it is documented. Mm-hmm. All of the pathways are documented. It's documented that 16-hydroxy regulates TGF beta. It's documented that TGF beta causes the upregulation of TIMPs.
Right.
It's documented that TGF beta changes the small cut fibroblast or the
your vampire. Yep.
Yeah, changes it from acute to chronic and changes it to myoblast. It's all well documented. No one has just finally said this is the connection from 16-hydroxy to lipedema.
Yes, yes. Well, and you've been alluding to that as you've been doing this studying, and we've talked, several times over the last 2 years, and how important the Dutch test is, and the connection with the MTHFR. I mean, it really is mind blowing. It really is.
It is. It really is mind blowing because they are easy fixes.
Right.
They're natural fixes. Well, I can't use the word natural. I'm sorry. Okay. I can't use the word natural. They are, they're supplements.
Okay.
It is not.
And that could be a whole other rabbit trail for us. Yes. And we'll have to stop recording before we go down that one because
we'll get in trouble.
That'll just get us in trouble for sure. So. Oh,
Yes.
Carla, thank you. Thank you. I know that this can be a lot. And I just want to show everyone that, like, this is what a chat with Carla looks like. You know, is taking 2 pages of notes and being a student of your body. And it takes multiple conversations once we get this cleaned up and edited, and I can share this out with everyone. But I'll be listening to this over and over because it is intricate, but it also is information that gives us more knowledge and more power and
Right.
can help the next generation and help our daughters and our sisters.
Exactly. If
Just
I had only
so big.
known this, Brandy, she had so much trouble.
Yeah.
She had so many problems. It's so sad that it's not. And I did publish my article on
Yeah.
a place that I did not have to have a peer review.
Okay.
And I have been criticized by two different people on Facebook. And I'll never understand that, because who in the world has problem with? And she told, one of them said that I would not be respected because I did not go by these studies at these different colleges that don't associate MTHFR with lipedema. But I have to tell you, I do not go by that. I go first by my patient's symptoms.
Yep.
And then I go by their labs and what those labs told me.
Yeah.
And I'll tell you, 97 to 98% of my patients do have MTHFR.
Wow. Wow.
And not only that, one of them that tested negative did her own complete methylation panel,
Okay.
and she had MTHFD.
Huh.
So there are, it's not just MTHFR.
Yeah,
It's
I do remember hearing
MTHFD,
that. Yeah.
it's MTHRR. There are
But
several.
there is some sort of methylation
Yes,
issue. Yeah.
yes. And
Yeah.
with COMT, you can be fast or slow.
Yeah.
So if you're slow, you're not going to be a good methylator. And if you're fast, you're losing your methyl groups before you can
Yeah.
even use them.
Okay. Okay.
So there's more to it than just
Yes.
testing. And I do appreciate you for letting me explain this. And
Love it.
this is what my discussion with the Lipedema Summit is
Yay.
going to be on also,
Good.
because I to take care of our daughters.
Yeah, yes. Amen.
Yeah.
Yes.
Take care of ourselves and our daughters
Yes.
and our sons, you know.
Absolutely. Absolutely.
Yes, and I also want to say that the circulation is mandatory. In the hospital, at the bedside, I have seen worst case scenarios of lipedema, and it's due to the lack of circulation. And they did not know, of course. And some of them at the time, I did not know.
Yeah.
And I had one lady that was admitted with cellulitis due to compartment syndrome, but it was obvious she had lipedema.
Yeah.
But I was in my clinicals at that time, and I couldn't even say a word, of course, because the doctors don't know about lipedema.
Oh my goodness. Well, you're doing the Lord's work. So I'm always here to learn and to share. And like I said, we're gonna get this out and get this circulating now. Speaking of circulation, we're gonna circulate the heck out of this and your article and everything.
Yes, and the article is there. Read it. It doesn't have a peer review. The second reason is that nobody has brought this up. Yeah. And I can't think of a standard doctor that would be a peer review for me on this. Yeah. And it's the first time it's brought it out. And please cite me in it. It's I've been studying it for 2 years now. So thank you so much for having me, Kristen.
Thank you. Thank you. Looking forward to see you on the summit. And like I said, we'll get this wrapped up and distributed as well. So thank you, Carla. Always a pleasure.
Thank you. Always a pleasure, Kristen. Thank you.
Bye-bye.
Bye.